Hi, my name is Dr. Robert Dweck. I'm a family doctor, and we're at Hudson River Healthcare in Amenia, New York. Today we're talking about low back pain. I'm going to give you the family doctor's perspective, and I'm going to try to give you some tips that you may not hear anywhere else. Back pain is an important message from your body. And you know, our bodies are a true miracle of engineering. So don't ignore back pain. If you have a macho attitude about lifting very heavy things, try to get rid of that attitude. I've seen too many men who've become permanently disabled because they have tried to lift extremely heavy things without the help of tools and without taking a little time in advance to figure out how to do it. You're no less of a man if you take a short time out before lifting something heavy to consider your options in order to protect yourself. When you do lift, always use your legs, keep your back upright, and hold the weight close to your body. Our habits of slouching in chairs, especially soft armchairs, couches, soft mattresses, and sitting in the car can lead to the gradual deterioration in ways that lead to a breakdown in the structure of your spine. By the time you start to have recurring episodes of low back pain, degenerative changes have often been developing for many years. Even though you can find a lot of helpful exercise on YouTube and the internet, nothing replaces the one-to-one work that you'll do with a good physical therapist who can determine exactly what you need. If you don't do this, you're likely to experience recurrences over the years, and sometimes each one is a little worse as the degenerative processes that lead to these recurring bouts get worse. Back pain is the number 2 reason for all visits to ambulatory care doctors, respiratory infections being number 1. And it's the number 1 cause worldwide of disability. So it's obviously a very important topic. I'm going to try to break this discussion up into 3 broad categories. First, acute mechanical low back pain. Second, acute low back pain that involves the discs, the nerves, and the vertebrae. And finally, chronic low back pain. And of course, every person and situation is a little different, and occasionally there are rare and very serious kinds of back pain that don't fall into these categories. But we're going to be talking about the common types that make up the vast majority of all situations. First, let's talk about acute mechanical low back pain, which involves the muscles that support the spine and usually occurs after an injury. Usually, it's off to the side, not right in the middle. It does not involve the nerves, so you will not feel the pain going down the leg or into the buttocks. And most of the time, if you sprained a back muscle, you can tell that it's a muscle. See if you can feel the area with your hand. Often getting off your feet, usually lying on your back on a carpeted floor or on some towels or an exercise mat, with your knees bent up, pillows under the knees, and a pillow under your head will allow the muscles of the back to relax. Sometimes lying in this position and putting a tennis ball under the sore muscle will allow you to gently massage it yourself. But don't mash too hard on the sprained muscle with the tennis ball. Moist heat also allows the muscle to relax. See if you can do some gentle twisting, rotating, and bending to gently stretch the muscles involved. Most of the time, you can feel what you need to do. If you can get a professional massage, that often helps this sort of injury. And likewise, acupuncture can help this kind of back pain, and chiropractors can too. It's okay to take over-the-counter medicine like ibuprofen, which is Advil, or naproxen, which is Aleve, for a few days. Most of the time, mechanical low back pain does not require a trip to the emergency room. and doesn't often even need a trip to the doctor or x-rays. Usually it will get better fairly quickly. But if the pain is very severe, sometimes painkillers or muscle relaxants prescribed by your family doctor for a few days can help. If more than a week has gone by without improvement, then again see your family doctor. If you get recurring episodes of mechanical low back pain, you need to learn about conditioning, which I will discuss a little later. Acute back pain that involves the discs, the nerves, the spinal bones, and the spinal cord is a little more serious. It can happen after what seems like a relatively minor movement, like bending over to tie your shoes. This is because the conditions that have led up to this moment have been developing slowly for a long time. And a minor movement is the straw that broke the camel's back, or in this case, your back. The pain in this case is usually more severe, right in the center of the spine, usually at the very bottom of the spine, and the pain can radiate into the groin, down the back of the leg, into the buttocks. All of that is called sciatica. The pain can be excruciating, it can be very severe, but even when the pain is very severe, it's still not absolutely necessary that you go to the emergency room or even the doctor right away. If there's no weakness of the leg or foot and no numbness in the leg or foot, it's okay to try some home treatments and wait it out a little while. Again, get in the position I described before, on your back, knees bent, pillows under the knees, pillow under the head, and see if you can find a position of comfort that way. If you can find a position where there is no pain or minimal pain, stay that way as much as possible for a few days. It's a good idea to take ibuprofen over the counter, 3 tablets 3 to 4 times a day, or naproxen, which is Aleve, 2 tablets every 12 hours for a few days. When not in a position of comfort, walk in the most natural way possible. Usually for this sort of acute back pain, heat or ice or ointments don't do much good. If you aren't making any progress in a week or the pain is very severe, then start with your family doctor. Try to avoid the ER if possible. If it seems to be getting better on its own, I still strongly advise that for this kind of pain, which involves the nerves, the spinal cord, the discs, that you eventually go to a physical therapist and learn about a back conditioning program. Unfortunately, millions of people suffer from this condition. It's the #1 cause for missed work and disability all over the world. If your lower back has been hurting continuously for 3 months, then you are considered to be suffering from chronic low back pain. For chronic back pain, you will need to be under the care of a doctor. Almost certainly, the problem lies with some degree of degenerative disc disease. The problem probably started a while ago with an injury to the disc. The discs are the soft structures between the building blocks of the spine, between the vertebrae. With time, the damaged disc slowly becomes worse, and as this happens, the bones, the vertebrae, start to go out of alignment. The joints between the vertebrae, called the facet joints, rub against each other and become inflamed and arthritic, and sometimes they can lock, and the nerves become irritated or pinched. As the spinal bones become arthritic, the holes where the nerve roots come out of the spinal cord become narrow, and sometimes the canal for the spinal cord itself becomes narrow. This is called spinal stenosis. If you have numbness and tingling in your feet associated with your lower back problem, that's a sign that you may have spinal stenosis. Even the most skillful orthopedists, neurosurgeons, and pain management specialists cannot always identify what structures exactly are causing chronic low back pain. MRI scans, which are usually done for anyone with chronic low back pain who goes to a doctor, often show a mix of problems. it's crucial that you work with a physical therapist again to learn a home exercise and conditioning program. I want you to understand this very important point. The point of physical therapy for all kinds of back pain is not to have the therapist do something to you. Though they may be able to give you some temporary relief, the more important thing is for the physical therapist to analyze your particular body, your anatomy, your posture, and to develop a specific program for you to do at home, to recondition your body and to correct the problems that have likely been developing for years. If you take just one thing away from this video, this is it. If you have chronic back pain, you must be active in changing your habits. It might involve losing weight, eating differently, strengthening the core muscles in the abdomen and pelvis that have been weak your entire life, and also it may involve learning how to deal with stress. Little by little, most chronic back pain can improve with this approach. Only a small fraction of people with chronic low back pain benefit from surgery. Avoid narcotics at all costs. If you get benefit from anti-inflammatories like ibuprofen and naproxen, which are Advil and Aleve, be sure to do this under the supervision of your family doctor, as these medications, while often helpful, can cause problems when taken over a long period of time. If you haven't found a family doctor, spine specialist, or a physical therapist who can help you, especially by helping you help yourself, keep looking for one and don't give up hope. If you have chronic back pain, you must develop the right mental attitude. You may have to deal with emotional and other stresses. If you're tense inside, you will hold tension in your body. Again, this is something you must find the right health professional to help you with, but it's a crucial point. Chronic pain cannot be successfully managed without this often missing factor. Even though learning how to relax and how to deal with stress and tension will not by itself solve the problem, it has been proven over and over again to be extremely helpful in relieving the suffering that accompanies chronic lower back problems. Thank you and good luck.